and welcome back to our YouTube channel. Today we are going to continue talking about anxiety. What are the different types, the symptoms, and some statistics to show how severe this problem is.
Keep in mind, this segment will stretch over the course of 3 videos, so don't miss out on the last video when we upload it next week. Also, if you haven't already, go check out our last video linked over here.
As we did last time, we used the information we gained from a simple survey we conducted to notice what the public knows about anxiety. So today, we are going to be covering generalized anxiety disorder, panic disorder, phobia-related disorders, and others.
First, we want to inform you about the ways anxiety is linked to underlying health issues. In some cases, anxiety signs and symptoms are the first indicators of a medical illness. If your doctor suspects your anxiety may have a medical cause, he or she may order tests to look for signs of a problem. Certain medical problems that can be linked to anxiety include heart disease, diabetes, thyroid problems, respiratory disorders, drug and alcohol misuse or withdrawal, chronic pain, and rare tumors that produce certain fight or flight hormones.
Moving on, already discussing generalized anxiety disorder, or GAD, in the last video, it is important to note the symptoms of it. Many thought it was having a fast heartbeat, excessive sweating, and having a loss of concentration.
These aren't far off since GAD leads to having trouble sleeping, feeling on edge, being easily fatigued, irritable, and having difficulty concentrating. Also, GAD affects 6.8 million adults, or 3.1% of the U.S. population, yet only 43.2% are receiving treatment.
Other people may also deal with trembling, having a sense of impending danger or panic, and experiencing gastrointestinal problems. Also, feelings of shyness or discomfort in certain situations aren't necessarily signs of social anxiety disorder. However, a structure in the brain called the amygdala may play a role in controlling the fear response. People who have an overactive amygdala may have a heightened fear response, causing increased anxiety in social situations.
This leads to panic disorder, or PD. People with panic disorder have recurrent, unexpected panic attacks. Panic attacks are sudden periods of intense fear that come on quickly and reach their peak within minutes.
These sudden panic symptoms are also combined with persistent lingering worry that panic symptoms will return, which often causes fear of those panic symptoms. PD affects 6 million adults, or 2.7% of the U.S. population.
Hot or cold flashes are common, especially hyperventilation and having chest pains. This can be heightened especially with phobia-related anxiety disorders. A phobia is a persistent, excessive, unrealistic fear of an object, person, animal, activity, or situation. A person with a phobia either tries to avoid the thing that triggers the fear or endures it with great anxiety and distress.
There are 3 major types of phobias. There is a specific or simple phobia, where people may fear specific animals, environments, or situations. These conditions are at least partly genetic, inherited, and seem to run in families. Specific phobias affect 19 million adults, or 8.7% of the U.S. population.
There is a social anxiety disorder, or SAD, where people fear social situations where they might be humiliated, embarrassed, or judged by others. The fear may be limited to performance, such as giving a lecture or presentation, or it may be more generalized, so that the phobic person avoids many social situations, such as eating in public or using a public restroom.
SAD affects 15 million adults, or 6.8% of the U.S. population. SAD is equally common among men and women and typically begins around age 13. According to a 2007 ADAA survey, 36% of people with social anxiety disorder report experiencing symptoms for 10 or more years before seeking help.
Finally, there is agoraphobia, which is a fear of being in public places where it would be difficult or embarrassing to make a sudden exit. People with agoraphobia may avoid going to a movie or a concert or traveling on a bus or a train.
These symptoms of these phobias may be either irrational or out of proportion to any actual threat. This excessiveness is also seen in obsessive compulsive disorder, which is an anxiety disorder in which Over time, people have recurring unwanted thoughts, ideas, or sensations that make them feel driven to do something repetitively.
It is also seen with post-traumatic stress disorder, or PTSD, which is a mental health condition that's triggered by a terrifying event, either experiencing it or witnessing it. Symptoms may include flashbacks, nightmares, and severe anxiety, as well as uncontrollable thoughts about the event.
Overall, many people fail to realize that occasional anxiety is an expected part of life. You might feel anxious when faced with a problem at work, before taking a test, or before making an important decision. But anxiety disorders involve more than temporary worry or fear. For a person with an anxiety disorder, the anxiety does not go away and can get worse over time.
If you want to learn more about anxiety disorders and what it is on the more fundamental level, we will have more statistics and websites linked in a blog post on our website. We will also be posting another video next week going more in depth about this issue.
Please remember that we are not professionals, and if you are dealing with an anxiety disorder or any other mental illness, please seek an adult or physician to confide in.
You can also call the suicide hotline at 1-800-273-8255. Don't be afraid to speak up.